take your time, read through, and then you make the claims. A lot of people rush and they make a claims and they think that what they're telling is right and they make a mistake. It's just like insurance is I'm not against insurance, but insurance is all about not paying the money. So because it's a business. Why
the lesser the payment, the more profit they make.
Why is the insurance have so much buildings in Malaysia? Why the biggest buildings all are owned by insurance? How do they build it with our money? So they are smart people. So that's the thing. You have to be careful when you make a claim. Be careful. Take your time. Think about it and no rush because your
medical field ni
pancreatic cancer
sama saya Dr. Roland Victor.
benda yang one of the worst stress can happen bila you makan tak sedap. Doktor, saya punya culture kena makan nasi.
Zaman moden.
That every second of your life you either earn or learn.
Batu Medic Show. Okay, this episode is brought to you by Ecocenea. Ecocenea is a powerful beverage which contains a lot of fruits and vegetables. One of the most interesting thing about Ecocenea is the concentration of its high ORAC value. So ORAC value is a way that we evaluate antioxidants, and the Ecocenea value is more than 60,000 units. So for those people who are looking for a good beverage which is rich in polyphenols, then Ecocenea is something that you should try. It's available at physicians, so please contact your doctor to find out more about Ecocenea 6.0. Welcome everyone to another episode of Lesung Batu Medic Show. Today is a good day at which we're going to discuss about holiday. But when it comes to holidays, the first thing we always think about is getting our tickets. The next thing is your luggage. And something that you always don't think about or might sometimes is your travel insurance. And when you think about travel insurance, you're going to think about your luggage, security, your ticket, your delays. But what about your medical safety when you are traveling, especially when you are going into some crazy adventures, going up hiking some mountains, going out for diving and stuff, because anything can happen in terms of your safety. And I have two guests who are very well experienced in the insurance industry as well as the medical evacuation segment when it comes to holidays and rescuing yourself back home safely. And today I have Dr. Vara. Dr. Vara, nice to meet you.
yes, hi.
And Jenny.
Yeah, hi.
Jenny is from Vietnam, right?
Yes.
And you've been working in Malaysia for quite a decent amount of years in the segment of insurance and medical travel.
Yeah, I have a 5-year experience working with AHE Insurance earlier.
Okay, nice. So let me just get, I want to go to Jenny first. Your experience when it comes to travel insurance, why is it important? And based on your experience, like what did you see in that 5 years? That why is it necessary? Even though sometimes a lot of people neglect, it's only like 20 ringgit maybe to just take a click on the package. Now I'll just skip it.
Previously when I don't work in travel insurance, I also don't think that it's really important. But once I work in travel insurance and every day I face into the cases that I'm handling. So now for all of the trip that I make for myself and even my family, I also buy the travel insurance. Because not just only about the luggage or like delay, this sometimes that is if really got the case that unfortunately you got the accident, or maybe you have a health condition, or sometimes they go hiking, for example, you cannot breathe, or you have a mountain sickness or anything. So that's the time that the travel insurance really can help you a lot and really can save a lot for yourself with a very big pay. Yeah.
For a very little amount of cost.
Yes.
Exactly. And during your time being there, how many cases like would you get like in one day? People calling you like how big? Like you're working in Kuala Lumpur, and to what radius were you all covering from Kuala Lumpur?
For example, for Malaysia only. So for around a week, then we maybe one day, we don't count by day because normally for medical cases will last so long. Because we need to help our client since they get admitted until that they discharge or maybe they go home. So we don't count by day, but normally for a week, we can have a 10 to 15 cases they get admitted.
in just locally? Or
They travel because that's it travel insurance. So normally they get sick when they travel overseas. Yeah.
Understand. And Dr. Vara, you have been doing this, if I'm not mistaken, at least close to 8 years now.
Yeah.
Has it been? How do you see this industry based on you yourself as a personalized doctor who works in medical evacuation, either sending patients out of the country or bringing patients back home?
Yeah, let me start with the insurance part. When you talk about travel insurance, a lot of people, especially Malaysians, they are not very aware about the insurance. How does it work? They think that their medical card, their life insurance is also a travel insurance. I have came across many patients who comes and say, we have all this insurance. We didn't know that this insurance covers medical. There are people who buys like 10 ringgit. I don't want to tell the airlines, then I'll get sued for that. So there are airlines which charges like 12 ringgit, 12 ringgit. Just imagine you go for a trip and you got like, for example, a surgery in Malaysia. A patient got a stroke and then and go for surgery is 100,000 at least. And you want somebody to cover with 15 ringgit, 10 ringgit, doesn't make sense. So you have to buy an insurance which is covers accordingly. You have to read through. The most of the time people miss is the small wordings, the policy wordings, the fine printing. You have to read it. Even when you make when there's no rush of you making the claims. Take your time, read through, and then you make the claims. A lot of people rush and they make a claims and they think that what they're telling is right and they make a mistake. It's just like insurance is, I'm not against insurance, but insurance is all about not paying the money. So, because it's a business. Why
The
is
lesser the payment, the more profit they make.
Why is the insurance have so much buildings in Malaysia? Why the biggest buildings, all are owned by insurance? How do they build it? With our money. So, they are smart people. So, that's the thing. You have to be careful when you make a claim. Be careful, take your time, think about it, and no rush, because your claim is not going to come very fast, especially, the one like accident, snatch thief and all the stuff. If you're medical, yes, you have to rush in it. But the other one, take your time, read through, ask those who have experience also. Just like any other police report, whatever report you do, you just take a bit of time.
But I'm going to throw this big but in here. The reason, if you look at it, you see, when you're buying a flight ticket, you just want to get the date, time done, click, pay, and out. Of course, are you saying that I'm going to read the fine print from the aviation company, fine print from the industry, from the insurance and everything? Where do you even look into these buttons? There will be some 5-6 small written pages to look into this. But you see, sometimes that only happens after the purchase. You don't even get to see those kind of
I have an incident which cost a patient 240,000 ringgit because of 3 alphabet. Just 3 alphabet make the 2,400 ringgit loss, because she should have put there beach bike, she put it there ATV, because it's ATV which is not covered by the insurance. If she have written there beach bike, she would have been covered. 240,000.
How does even that happen? I mean, that's just a vehicle.
She went for a holiday and she drove a beach bike. You can call an ATV beach bike, a quad bike. You can call it as you want. It's whatever, and her friend accidentally put it ATV. And in the fine print, it's written there as the extreme sport. ATV is part of extreme sport. Bungee jumping is clearly written the ATV. So it's not covered. The insurer doesn't want to cover. No. Just because of 3 alphabet, you lost 240,000 there. And I brought the patient back.
At her own cost?
At her own cost.
Wow.
Far, far away.
So, when you travel, you see the importance of travel insurance, especially as a physician, when you travel and you see sometimes the most nastiest of evacuations that you have to do. Am I right?
Yeah.
It's not just like this small kinds of small injuries. Sometimes can be massive traumas, heart attack, stroke, cardiovascular arrest, all of this.
Yeah, accident, fall from the buildings, everything happens. Accident happens. It never tells you and come, it just comes at its own time. That's why I say, when you say, I'm just traveling for 3 days, How sure are you that 3 days nothing happens? Things can happen. Most of the time, things happen when you don't anticipate it. When you anticipate, it won't happen.
Yeah, but I'm going to leave Vara for a while and get to Jenny. But Jenny, if you look into some policies, because example, like I experienced one policy I had when I was like 20 something. The policy had a life coverage, a medical insurance, and in fact that it was covered by one of the brands, okay, an SOS sort of agency. How sure that the normal people who have just say like a general policy or a medical coverage that they don't have this thing adjunct, or they have to go in to see whether their medical insurance has coverage internationally or only locally? Is there anything like that based on your experience?
I also buy my life insurance, but normally life insurance and travel insurance will be separately. That one, the life insurance not include like the travel insurance.
How about a medical insurance? Is that some medical insurance inclusive of also traveling?
No.
In terms of other countries where you get...
Never came across.
No.
Okay. So that means if
But
you have...
sorry, I want to add on.
Yeah.
There are some corporate companies, they buy together. Their companies have their own
different premium.
They give premium where it covers when you are at home, you travel, because they are traveling type of business which make their employees to travel. That one covers, but that one individual you can't buy. It's all the corporate come like credit cards and all these guys. They have
Understand.
let's say you got a credit card in Malaysia. Some credit card it attached with insurance, so it covers you in Malaysia. It covers you overseas.
Okay.
As long as you have your credit card, something like that.
Understand. So most of the time, if you even have a medical insurance, the medical insurance only covers you in your own country parameters. So if you cross the border, even though if you go to Singapore and something happens to you, you're on your own there.
Yeah, it happened to my colleague also. She thought that one can cover in her home country or something like that. But unfortunately, when she make a claim, so they decline that because they say the medical insurance just cover within the country. It's mean like, let's say you live in Malaysia and you buy your insurance in Malaysia, so only cover anything happen within Malaysia only.
Okay, so that's why the need to have this form of travel insurance is very important, and it also makes sense that when you say like certain corporate companies like oil and gas companies or companies where they have staff traveling all the time all around the world, they need to have a sort of like an international umbrella to protect them if they are in country A to moving to country B and then back to C and D like that.
And another thing in the travel insurance also, there is option for you. You can buy it in certain days. You can also take annual policy. So like me, I travel a lot, so I usually take annual policy. So I take the best one and I take the annual policy. So it covers you. You can just forget about the travel insurance. Every year, April comes, then I renew my insurance.
Understand. So is that provided by local companies or it has an international company?
Local companies, international companies.
So it's available for local people to get it.
Yes.
Understand. Okay. And when traveling like this, what kind of evacuations and medical scenarios that you have to face?
If you talk about that, it's going to be take a long time. But what I can summarize is travel insurance. When you talk about Medivac, this covers only. There's 3 ways options for you to Medivac. Medical evacuation. One will be by business class. Another way is by stretcher, a commercial stretcher we call it, and a third one is by air ambulance. So
the first one, what's the first one? So
business class means the patient is unable to sit.
Okay.
And we can, if the patient required oxygen, we can give them oxygen. I even have brought a patient on a BiPAP in a what to call it in a business class. Depends on that. We can use our monitors, but all that we need to get a prior permission from a commercial.
So
flight.
you will fly via a commercial flight.
Yes, just any kind of flight, Mars, Batik, or Air France, Air India, whatever airlines. But you must get a prior clearance before that. But of course, most of the budget airlines doesn't fly. Like Air Buddha.
They don't have business classes.
One, they don't have business class. There are some which have business class, but they don't have medical team to approve this.
Okay.
Yeah, so that's another thing also. But that's the thing. And then the third one is private jet, which is air ambulance. I mean, ambulance which flies. It have everything inside: a ventilator, oxygen, whatever amount of oxygen you want. We can even bring a anything. We can bring a incubator. Everything we can bring. No problem. There is no limitation for it.
And how many jets like this are there in Malaysia?
Malaysia, owned by Malaysia, we only have one in Subang. That's all as of now. We do had a few, then it came, but it's not owned by Malaysia. It came in, then it went out.
So it's almost like this. It's just like on parked here, on standby.
Standby for a while. Then they'll go out. And as of now, we had a few. I think we've got 6 or 7 in Singapore for now.
So on average, in this whole Southeast Asian region, how many cases like this happen in a day? Like because like only like Malaysia, only like one flight is on standby here.
We have a lot actually, but the thing is, of course, the price, it depends on the price. Like for example, business class is the cheapest among all. The second comes with stretcher, but stretcher, there's another issue, is taking approval to get the stretcher. It takes about 3 days to 7 days, depends on the airlines. And of course, the fastest of all is air ambulance, but there's a cost. We're talking about at least 15 to 20 times more expensive than a business class. So that is the price and all those things lah. Depends on it.
I understand. Jenny, just to ask, based on your management and your experience in the managing situations and crises like this, right? I'm pretty sure there's definitely going to be a variety of premiums. You're seeing like some patients who don't have to pay at all. Some maybe have to pay and then claim. Is that those things exist?
It really depends on the premium that you bought before. They have so many plans, let's say like basic or classic, or depends on the one you paid earlier. So later on you can claim and you will have the limit of your benefit. I mean, something like that. Then you can claim based on that. So for example, if let's say you just buy the basic plan, so maybe the cover for the medical expenses only go until like, for example, 200,000. But if you buy the premium one, then maybe you get like 1 million. You can claimable.
Okay.
Yeah.
So people have to be very wise in buying when they know where they're traveling and what is their risk appetite already going to the location.
Yeah, it also depends on the location. If you just travel within Asia, so it will be cheaper. But if you go, for example, to Europe, so it will be different. And if you want, the one is the cover for worldwide, it's similar for all of the country, then will be different also.
But usually when people buy, most of the time maybe what you're referring is like maybe like a corporate client, like going to like that big kind of package. But when people are traveling in this short period of time, let's just say they're going like 10 days to London and back, and where would they actually go and buy? Would they go and buy this kind of packages like separately via the insurance agencies, or they will just most of the time just click add on to cart and just purchase? What usually happens based on your experiences?
Based on the corporate just only cover under the company. So whenever you have a business travel, then you only can use the corporate policy. So if you travel by your own, for example, within like your family, or you visit someone not related into your work, so you need to buy by your own. Like some of the big company you can purchase online, but then some, as I know that you have to go through the agent.
I see. Agent means the airlines, is it?
Some they whether have like travel agent or some is an airline, but to be honest, some of the airline they don't cover for medical expenses. Just only happen for the accident. So when you read through, you have to check on that, because it really happened to some of my friends also. They, for example, they buy by just AA, for example. So when they travel, and then after that, the daughter got like sick, and then they have to get admitted, and then they bring back. But when they read through, because that's the sickness, so they don't cover. That's not an accident.
Okay, so
it only covers bag delay and flight delay.
And then accidents. Like
Yeah.
so accidents also is like by
Accident, when
definition.
I'm talking about real accident, like you fall down, you hit your
So
head.
they cover that, those kind of things they cover. But if it's like
trauma, like you can only put trauma.
Okay, trauma.
But like for example, from medical, we as a medical, for us, a stroke also is a accident. But for them, it's not accident. You must be hit by a car
okay,
to get,
not hit by a plane. Eh?
not by the plane.
Got the definition of the accident.
Okay. So they will usually. So that's why you all emphasize on really reading the fine print on what you're getting. If you don't read and you just buy, you think it's cheap. You just buy. Oh, there's coverage 100,000, 150,000, and then you don't understand it. So if you get a medical situation, then it's a different story. But yet again, there's another one more thing to also ask both of you. Maybe both can answer together. Is there are also situations that people come with certain diseases. For example, like maybe a guy who's like 65 years old, going for a travel in maybe US, and he's got diabetes, hypertension, cardiovascular issue, done a bypass before. How would the insurance know when he's just clicking and buying like that, like a package? Is it covered? Or then again, the fine print, if you got all of these issues, then you're not covered.
You let Jenny answer first. I will top up.
Okay. So for Malaysia, unfortunately, we don't have the policy to cover for pre-X condition. The one we call pre-X.
Pre-X condition.
Yeah.
Okay.
However, for example, if you had that attack, but because the heart attack caused by the accident, for example, someone hit you, you have a heart attack, then you pass away, that one we cover. but just, okay, you stay at home, you're sleeping, and you have a heart attack, then that one not cover.
Okay.
Yeah, but as I know that for some country like Australia, they have a policy to cover for your pre-X condition. Yeah, even
Okay.
you need to declare your pre-X and then you buy the travel insurance.
So
It will cover for-
with a higher premium lah.
yeah, but unfortunately in Malaysia, and I know that within South Asia, we don't have any policy can cover for pre-X yet.
Okay, Malaysians, take note of that. We are not covered. If you're sick, you can choose. Can you then buy another premium from another country?
There are a lot of insurance that is quite global type of insurance. I forgot there's one quite expensive. The premiums are very expensive. A simple, I still remember when I went to Nepal back in 2019. I checked on that. The insurance in Malaysia cost me about 700 ringgit, and that insurance cost me about 2,400 ringgit for the same time of duration. But it covers everything, and it's the coverage is like anything happens to you, you are covered, fully covered. Whether it is medically or non-so medically, they don't even check your pre-existing condition. They will just cover it. That's the thing. So pre-existing condition, like what I say, you have to check on it. There are a lot of insurance that you can buy from Malaysia. Because when you buy online, there is a lot of information you need to put it. Where are you from? What date? Which area you're going? There is the zone, zone 1, zone 2, zone 3. I think zone 4 is global. And then where are you from? Everything, your age, everything you put, they will summarize and give you the amount.
The cost.
The cost. So based on your age, your pre-existing condition, everything you put, it will go up and up. So if you put everything, you declare everything, and you pay the amount that need to be paid, you should be covered.
Understand. But
Because that means nobody can fly after 50 years old then. Because as we know, most of them are sick now. Everybody have diabetic, everybody got hypertension. Even the flying, when you fly from Malaysia to US, that takes you about 30 hours. That itself is so stressful.
You're right. The DVT, all these kinds of things you're thinking about. And then, because I'm thinking like, imagine like a classic scenario. Individual A takes a premium medical card at the age of 30 years old. Low premium because young, no non-communicable disease issues, no diabetes, no hypertension, everything. Moving towards 45, got diabetes. Moving towards 50, did one stent or 2 stents, and then after that, still traveling. And if in a situation somewhere around the world, let's just say, let's not go far. Let's go just even Singapore. It's crossing the border from JB to Singapore and gets a cardiovascular event in Singapore. I throw you this question: what happens next? his card's not covered, can they even just use like, okay, basic evacuation? Maybe he's admitted in a hospital. What happens in, as close as we can.
Like I have came across that type of situation, real situation. They didn't buy any insurance because it's just 10 minutes away, across the border. That's all. So what they do is they get the ambulance. They have to pay the ambulance to bring the patient to Malaysia. The nearest place to send patient to JB, Johor, and then treat the patient.
That one also is like,
if the patient is stable to travel.
If
they
not stable?
not safe, then have to pay. And Singapore is the most expensive medical in the whole, Southeast Asia. It's crazy
almost
amount.
like US.
US, almost like US.
It is like US.
Yeah,
Really?
One day it can cost you about 3,000 to 5,000 Sing dollar per day
Just
in
to
the
be-
ICU.
ICU.
It's already quite cheap already. What I'm telling.
Has scenarios like that? Have you faced along the years in this?
We have a lot of like customer, they travel to Singapore and unfortunately their bill is very high. But because the one who reached out to me, they already get a policy. So in that case, whether we cover or not cover only.
Can they just do the evacuation? Would the evacuation also be covered in that kind of situation?
Usually, if the insurance covers, then you just get a treatment there.
Yeah.
Okay.
It's the best treatment.
Understand. But then there could be like certain places you might be stuck in somewhere like Sulawesi or something like that.
Yes.
What happens in that situation when they don't have what you need? Then you gotta get the flying ambulance.
You have to bring the patient back. If the policy covers, then the insurance guys will pay. If not covered, then you have to chip out from your pocket. There's so many cases that they have to, the parent, family members have to chip out from the because most of my cases are not emergency medevac. Most of it are like they come for treatment here. Like a patient who have cancer in Indonesia, they come here for treatment. It's already stage 4. Suddenly the patient got pedal edema, abdominal distension, cannot fly. Then they need to evacuate with oxygen and all that. That's most of my cases. Of course, I do get this type of insurance not covered cases also. But generally, you can say easily 60% of my patients are for travel, medical tourism.
So I'm pretty sure you have like patients who are like already on intubation and you have to like bag all the
I
way.
got so many patients that
Have
I
you bagged the patient how far?
usually I use ventilator. Easier because when you take off and landing, you need to sit. So you can't be bagging at that time, Yeah. But of course, we bring all the equipment required to bag the patient also.
I understand. How far have you experienced like such case like this? Any interesting cases?
Oh, I have so many. I have done cases far away, like Montreal, US, KL. Yeah, not KL, because some of my cases are not even from Malaysia.
Okay.
They are like Singapore, Delhi to Paris, Miami to Manila, Japan to Melbourne. All type of cases we do. All type of area. There's no boundaries for us. We can do any cases, any country.
So that throws me to another question that is such a global operation. Communication. How do you all coordinate a Malaysian doctor suddenly maybe in a country that doesn't speak languages that we understand? How does that happen? Do you all have a team at the back end also to help?
Like the insurance that I worked before. So of course we have a speaker, the one who can assist you to be the interpreter. And then in the case, unfortunately, even that we don't have anyone can speak that language, we will have our provider. We like our previous insurance, they always have the on-call interpreter in any language.
Any language.
Yes.
Wow.
So that's why very important that you choose the insurer. I mean that the insurance company, if like they really have to say well-known and then they have a good service, even sometimes you have to pay like more than a little bit, but then their service will be much better if anything happened to you. Understand.
Yeah. And in situations like that, do you also have like an assistant or they provide you a?
It's actually a very big network. Like I also work with many companies. I got a company in New York works with me. Singapore, we got a few companies. Bangkok, we got a company. India, I got 3 companies. Dubai also we got a company. London also we got a company. So we all work together.
It's like a very
It's like a network. It's a network. Yeah. Like sometimes, like that day also, I got one case in where was it? One of the Eastern Europe. I had a case, so I asked the help from the Dubai guys. So they helped me with that. So my work was from Dubai to Singapore. They did that Middle East. I forgot the country, Romania or something like that, to Dubai. So we did half. So we usually work together. We don't like because the one who's involved in this field is very, very little. Not many people. Very few people are into it. So we know each other very well. In Southeast Asia, I know all of them actually. So same goes international also. We know.
I understand. So how just for the people out there, Malaysians, how many doctors in our country, Malaysia, are involved in this kind of operations?
When I started long time ago, when I started the company myself, at that time I don't think that any of them, but recently there are a lot of them. They have their own companies. They are running the show, and yeah, there are a few. I think not more than 10. We're talking about less than 10, and now quite a number of ambulance companies also started doing it already. Yeah.
So it's much more of a network lah. What we see is that it's much more a network. Whether there's 20 companies or 10 companies or 5 doctors, everybody belongs to sort of like the whole web itself.
Yeah.
Because you cannot work solo in this. It's such a big conglomerate. Even maybe the big agencies also sometimes in really remote conditions, I think the small players have to ask their mercy to get certain operations because they might have the tool, the equipment.
Like there was a big company in London. They are not only in London, but they're also in US. Also, they're a very big company. I don't want to tell the name. They had a patient in Langkawi. So I brought, and that time we had a problem where all the flights was down on maintenance. There was no any private jet in the whole area to bring the patient from Langkawi to KL. So we used another way to bring the patient, and they were very grateful. We brought the patient. Patient's 83 years old gentleman with upper GI bleed. So we were transfusing in the ambulance while bringing the patient on inotropes and all the stuff. We brought him back to KL, treated him. He got well. Then we flew him from Malaysia to London. So that type of things also happen. So it depends on how much you are involved, and they also know. They will also go through your background, how many cases, I don't know what type of cases you have done and everything. We have done also cases in Bangkok, patient with a 10 years old child with a frontal tumor, huge frontal tumor which fits every day, non-stop. And we flew a patient all the way to somewhere, Minnesota or something like that. So that
In US lah.
In US. So we are flying almost 1.5 days. So we are talking about at least 3 times she will fight in the flight. So how do you manage that? So how do you get the clearance from the airlines? Because if the kit fits before the transit, the airlines won't allow you to fly, continue your flight. They will tell you to go to the nearest hospital to stabilize the patient. So you have to make sure that she doesn't fit. So that type of things all you have to do. There's so many things involved.
It's like almost like an ER with in the air lah,
Yeah.
institution. And what happens sometimes in a situation like this when you have whether it's a travel, we call it like a travel insurance, right? Still doing traveling. In a situation where treatment is conveyed, done in another country, but then the patient doesn't make it, is the evacuation back home, I mean, whether the person is already deceased already there, is it managed still by the card or is a different position at that point?
The patient must be fit to fly. So that one had to back to Dr. Vara duty. So they have to get the confirmation from the doctor that they are fit to fly.
Okay.
Then in the case that they don't want to make the treatment there, so make sure that they have to fit to fly, then we can evacuate them back to the home country.
Okay.
Yeah.
What if the patient actually gets treatment there in the country, but then doesn't make it? He dies or she dies in the country.
Oh.
Does then that evacuation? I mean, no, it's not evacuation.
Yeah.
It's
Body
just
bag.
bringing the body,
It's called
body
bag.
back.
Yeah.
Is that also covered by the travel or no?
Okay. So like this, if your condition covered by the policy, and that's one not under React, so we cover. So for that one, the body bag also be covered. And then some case we even that you burn the body and you can bring back the ash or something that would also be covered. Yeah.
I see.
And even for the Muslim, So they have something they need to do, like for Muslim,
The
right?
rituals and-
So this one also be covered and arranged.
I see.
Yeah.
And I have seen also policy which didn't cover the treatment, but it covers the body bag.
Just the body bag.
Body bag.
So that means no medical treatment.
So
body
that's why I
bag.
say the policy wording is very important. That's where they play around. And when you ask somebody, like a lot of people made a mistake where they say that, I bought like tour agency. They say that, I bought from this agency. So, and when you ask him, he also won't know, because he's even us working here in the company for many years. We also won't understand the policy wording. It's all about the underwriter who understands the wordings. They word no, because every policy is different. Every single policy, every country different. Everything is different. So there is no one we say, okay, I bought this company, is it covers? Cannot say.
So how that brings to the big question: how do you actually end up knowing what is good and what is mediocre and what is rotten? How do the common man go out there on a travel? What is there an average? I was like, there cannot be a number to evaluate. Sometimes we don't. It doesn't mean if you pay high, you're going to get good quality. That's something wrong to say. But what they want to look at? I mean, you understand the policies. I'm going to ask you on that question, and you might know on the policies, but for you, it's like, what kind of experience that the patient is the person who takes the premium is going to see. I'm going to ask Jenny first.
For myself, normally, and I check like any policy. If you go to their website, for sure they will escalate their policy there.
Okay.
So you can check. Maybe you just scroll down a little bit. Then they have a policy wording. Before you make any decision, you read that. Unfortunately, if you still cannot understand, you can make the call to their customer service. Any insurance, they will have customer service. You can ask them the question until that you understand. Then after that, you can make the decision. Don't just buy and then after that you claim. They say cannot. Then you say, this one not same as how you said before. But no, sometimes that the agent, they also cannot understand fully about the wording in the policy.
True.
Yeah.
And you said the policy is so dynamic. It can be in a zone, which
Yes.
location, which time you go, which whether it's going holiday period, non-holiday period, or the cost is so diverse. But
Yeah.
in those kind of like articles and all that fine print, is there any specific columns or anything that people need to look at? Is it benefits or
Everything.
Yeah, everything.
Every
My
single
God.
word is important.
So before you go for a holiday, you need to read the fine print first and be satisfied.
Every single word is important.
And based on yourself, it's like, even as you being a professional, a medical person traveling, that, I mean, you also have to get a certain decent coverage.
Yes.
And the question to you is, what are we looking at paying like to really get a solid coverage? For example, someone who's really traveling like maybe a month in, month out, they're being like shuttled everywhere.
No, it depends. It depends. Like for myself, I usually take the global one because I travel global. But those who don't go don't need to buy. If your guy just goes to India 5 times a year and you only go to India, Sri Lanka, and maybe Thailand a few times, that's all. You don't need to buy in the US because it's going to be cost you a lot. Because the policies is all depends. They know the insurance. They
The
know
risk.
they know not risk. They know each country's how much is going to cost you. Like AGE, like a patient go for abdominal, diarrhea, vomiting in Malaysia. You go to a GP, will cost you 200-300 ringgit. In US, emergency department will cost you about 18,000 ringgit.
But for AG,
AGE.
are you serious?
Yeah.
Yes.
I have claimed a patient.
Really?
I have done it.
I make the bill.
I
Oh my
claimed a
God.
patient 18,000 for a drip and 1 injection and no discharge medicine. 18,000 ringgit.
We need to
so
change
we are not
place lah
talking.
now.
We are not joking here. This is serious. game.
Serious stuff.
It's really stuff. Here in Malaysia, you go to a GP, you pay 200, they'll fire you.
200 is already like
Yeah.
super first class with the
They
best
will
original
fire you
medication.
in the Facebook, Instagram, saying you are the cutthroat doctor,
Physician, I see.
physician in the world. But 18,000 they will smiling and giving you in US. Yeah,
Yeah.
I'm not lying.
$18,000 or ringgit?
Ringgit. It's about
Okay, so that-
$4,000.
Wow.
4,000 US. I got a number. I just cannot talk for 2 days. I just silent.
Whoa.
Nothing. It didn't even give you discharge. Here you go, the GP will give you 6 medicine to discharge you. There, not even a single, not even activated charcoal G gave, that the doctor gave.
And then you need to get a prescription and get it somewhere.
Yeah.
So is medication covered then in this kind of situation? Because you see, the policies in every country is very different. For example, like Malaysia, usually the bill might come together with medication. In a situation maybe in another country where maybe like India, as far as I know, like the diagnosis and prescription is one fee, and then they give you the prescription. You go out and you buy your own medication. How is that? Is there
For buying
fine
your
print
own-
also again to read?
No, I don't think like your buy own medication. I don't think they will cover for that.
It's very difficult to say.
Yeah.
Very difficult. It's subjective to the policy wordings.
And also subjective to the country, because the country's laws are different.
Yeah.
Because some countries like Malaysia, like okay, the physician can hold the medication in their practice.
Yes.
Hospital, different situation. But in certain countries, they just write for you, go outside, buy and come back.
Oh, yeah.
Yeah. How is it like in
But,
maybe other countries like Vietnam and
I've
everything?
seen a patient who been the insurance covered. I don't know which insurance is it. In India, as you said, the patient was admitted. So the family member went and bought the medicine and it covered. So it depends on the insurance, how the policy wording works and all the stuff.
Understand?
Yeah.
And do people even buy
And
like
as you know, outpatient thing is another totally different story, you know. Yeah. This what we are talking about is admitted patients. We are not talking about outpatient, you know. That
are they covered outpatient?
That also depends on the policies.
Okay. How about some people even buying group policies? Does that exist? Group packages.
Group policy.
So that also have to read the fine print again. It's all about the fine print.
Fine print. It's all about fine
now.
print. Because that's why they put it as fine. So it's fine that you don't read it and you buy that. That's why I say a lot of people are buying it just for the namesake of buying. Oh, I already bought 10 ringgit. Oh, I bought 10 ringgit insurance today. If you don't know, don't buy. Don't waste the 10 ringgit. You're just giving the airlines extra money. It's just better you just donate to somebody the 10 ringgit because it's not going to work, you know.
Understand. And what would it cost? I mean, just for the users out there lah. A ballpark number. What is it costing? Like if someone like in your situation, you have like a global travel kind of insurance, you travel all the time. What's it going to cost like?
The insurance? I took my travel insurance last year, April till this year, April. It covers 1 year global. It cost me about 850 ringgit per year.
Okay, that's not bad. But we're talking about everything all in.
All in. And it's not the highest one, it's the second level.
if
But
the
it still covers quite enough. You don't need whether 5 million or 3 million is not a big, you get a 2 million is good enough already. You don't need to have 5 million.
But again, you say it depends on the risk that what's going to happen.
No, if it covers, it covers.
But
Yeah.
if you're in Singapore and then you are there for like 90 days,
Gone.
then the insurance
then it won't be enough.
is
But
busted already.
before that, you usually will, if you are staying in a hospital for 90 days, it's usually before that they will try to evacuate. The insurance will try to evacuate.
Okay,
as
so
soon
the
as
insurance
possible.
also
They will
understands that.
because every day they're spending money.
Yeah.
Okay.
They're not going to wait until 3 million finish.
So
you know?
the jet is cheaper than the keeping you in the ICU.
Yeah, they will find the best mode, the safest mode, everything they will check, the risk, everything. Then they will try to move back. Once you're back home, their work done. They won't cover you anymore.
Okay.
Yeah, some of it covers a bit.
No, God.
Some of it covers a bit.
So maybe
30
then
days or
your
something.
own medical card or if you are
But not all insurance
Not
got
all
that
insurance.
benefit.
Not
Yeah.
all insurance. There's some insurance
Okay.
covers.
So any last messages before we wrap up to the people out there? How important is travel insurance?
Yeah, it's very important. Whenever you travel, you should buy. You don't know what will happen because just for some example that you just walk on the street, people hit you in that time. You also cannot say, oh, I don't have any fault, right? But people can hit you or anything can happen for disaster. For example, like the case that I handled before is the earthquake in Nepal. Do you remember for
Yeah,
2019? So that time I worked for travel insurance and they really arrange their own plane, the aeroplane to bring everyone back home safely. So in that case, you will never know what will happen. But then if you have the travel insurance, sometimes really can save your life.
Understand. Dr. Vara?
Talking about travel insurance, I think buy if you really understand, and you must buy it. Don't just waste your money buying cheap one and say, I have already. Read it through. If you don't understand, as what Jenny told, please call. You talk to them until you really understand. It's a free, most of it is toll free. Mm-hmm. So it's not this one, and they have all the language, Bahasa, English, Mandarin, Tamil, I'm not really sure, but you can, if you don't understand, you can ask anyone at home which is educated to talk to them and find out. And you must tell them, why are you going? Are you going to a temple? Are you going for a scuba diving? Are you going for a hiking? Are you going to climb the Everest? You tell the thing. Be truthful to the insurers. Tell them. And if you have any medical thing, you just tell them. Don't lie anything. They will find out. They will know. And it's not only that, it is also delays, and it delays the whole process. If a patient have following up from hypertension in a GP clinic nearby, he had been diagnosed earlier, and then when they say that sometimes our people are quite negligent, they say, no, I'm just taking little bit. For them, it's 5 milligram amlodipine, is little bit, but it's already diagnosed as hypertension. Hypertension is hypertension. The moment you take medicine, it's already hypertension already. So for the insurance, they won't cover. So you have to be truthful. Tell them. And then once they say don't cover, then they will, you can think of alternative way to bring. If no, they will say, okay, wait, we'll check on it, check background, check all the GP. That will take 2-3 weeks. By that, your bill will go up. And then that also you have to cover. So do it fast.
Understand. Okay. Thank you again, Jenny and Dr. Vara. So big take home message is, when you travel, especially from Malaysia, out of the country, I think in Malaysia, if you have a medical insurance, it's all right. You get direct access to private hospital. If you don't have access to private hospital, you have the public hospitals, the government hospitals for you to access. So you are technically in a safe zone. But when you cross our parameters, when you cross our borders, now whatever service or medical cards that you have with the local brands now do not cover those zones. So you need to make sure that whether you're traveling by land, whether you're traveling by sea, whether you're traveling by boat, or whether you're even swimming across the borders, please make sure that you insure yourself. And before you even insure yourself, examine the policies to see what kind of coverage that you have. You might want to go for an ultra marathon in another country and realize that, look, you're not even covered by that policy, a general policy. Then you need to find something that will cover you for such event, because it's going to be very, very thing. Because people don't think about this. You always think that it's going to be a fun holiday and an experience climbing some mountains or going for diving and stuff. But anything and everything can happen anytime.
Dr.
You want to add one?
Just
jump
one
in.
small
Okay,
thing.
please.
And please don't ask advice from anybody. Just call the insurance company and ask them directly. A lot of people make mistake by asking another person who bought the same insurance.
Or maybe another agent, or somebody have bought the same insurance some time ago. Because even the insurance policy changes, they every time they have a meeting, they change. The best, just call the toll free and find out. Any insurance, I'm not promoting any insurance, but just call them. All of them have toll free. Just call them, no problem. Okay, thank you. So once again, thank you for our sponsor today, Ecocenea 6.0, an antioxidant beverage with almost 60,000 level of ORAC value. Until we meet the next time, kita lesung kau. Okay, this episode is brought to you by Ecocenea. Ecocenea is something that you should try. It's available at physicians, so please contact your doctor to find out more about Ecocenea 6.0.